Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. According to the Centers for Disease Control, half of all sexually active young people will get a sexually transmitted disease, or STD, before the age of 25, and most will not know it. Today, we'll talk about what's being done in our community to treat those with STDs and to help stop new cases from occurring. With me today are Thurman Hoskins Jr., a community resource specialist with the Lincoln-Lancaster County Health Department, and Lee Heerten, educational coordinator for sexual health at the University of Nebraska-Lincoln. Let's start with Thurman. How are you today?
I'm fine, thank you.
Good. So what exactly is a sexually transmitted disease?
Sexually transmitted diseases come in two categories, actually, bacterial or viruses. So when we're talking bacterial, we're talking gonorrhea, chlamydia, syphilis. And when we're talking viruses, we're talking more or less like the HIV, herpes, genital warts, those kinds of things. And with viruses, there's no cure, so all we can do is provide treatment. And the one thing I think that people look for is symptoms sometimes to sexually transmitted diseases when sometimes there may not be any symptoms at all. What we want folks to know is if I've had unprotected sex, that's the risk. How do you acknowledge the risk? And because of that risk, it could lead you to those sexually transmitted diseases. Syphilis is on the rise right now. It's actually running as a co-infection with HIV, so we're seeing a lot of co-infections that include HIV and syphilis. Sexually transmitted diseases have been here for many years, and it hasn't gone away, and it's not going to go away unless people decide to take some action in reference to protecting themselves and their families.
What's the most common STD that we're seeing here in our community, and what should people know about it, such as symptoms and things?
Well, one of the most common STDs that we are seeing, not only in Lancaster County but nationwide, is chlamydia infections. For whatever reason, there's a certain age group that is being truly affected by this between the ages of 15 and 24. So that's probably the most common. Syphilis is on the rise, though, again.
So how is the health department involved, and what sort of message are you trying to get out to the public?
Well, the health department is involved in many ways by offering testing, and we've actually included a new testing option. It's called the STD Express Clinic. So our testing sites are Tuesdays and Thursdays, Tuesdays 1 to 3, and Thursdays 5 to 7. So we try to provide easy outlets or access to our testing. The message is basically people should get themselves tested if they feel and acknowledge what the risks are in reference to what STDs are. So know the risk, know what puts them at risk, and come see us.
Okay. What options does somebody have for confidential testing?
It's all confidential. It's all confidential. In fact, the ages are between 12 and up that we can see clients. So if a young person comes into the STD clinic, they don't have to worry about their parents knowing about it, as far as feeling safe. In reference to testing, or excuse me, in reference to treatment as well, we don't refer to their parents as far as what medicines they may or may not receive. So it is confidential, and confidentiality is really one of the things that we strive to enforce, as well as to let the community know that we're a part of and strongly believe in.
Okay. Now, who do you see come through your clinic?
Oh, wow, that's a very good question as well. We see all kinds of folks that come through our clinic. As I said, the age is primarily between 15 and 24, but people who are just going back into the dating scene, for instance, people who perhaps have been married for some time or have questions about their partner's health as well as their health, they will come in and see us. So we don't want to imply that it's a young disease, because anyone can get it based on what they do. So if anyone puts themselves in a position to have unprotected vaginal, anal, or oral sex, that's considered a risk for STDs.
Okay. Now, where can somebody find more information, some resources about STDs?
Well, I think we've got some sites posted, I believe, and we have a website, www.lincoln.ne.gov. And there's also 441-8065 is our information referral number. Or they can call me at 402-441-6248.
Okay, very good. Now let's chat with Lee for a minute. For the 20 million new STDs in the U.S. every year, half of them are young people under the age of 25.
Yes.
So what is being done at the university level with education, and what challenges are you facing there?
Yeah, well, we have a focus on a couple different areas. One is prevention. So we want to give young people the tools and resources that they need to not get an STD. On the other hand, we also have clinical resources for young people who think that they might have an STD or who have been diagnosed with an STD. I think the biggest challenge that we face in either of these realms is fighting some of the stigma and the shame associated with having an STD or perhaps being at risk for an STD. So that's where a lot of our educational messaging is focused on reducing that shame, reducing that stigma, making it easier for young people to access preventative or clinical services.
Okay, what are some of the biggest misconceptions that young people have about STDs?
Sure, well, the biggest one is young people think that they're invincible and that nothing bad can happen to them or ever will happen to them. And that's a hard one to challenge because developmentally that's where they are. But it's also reinforced because young people aren't talking about getting STDs or getting treated for STDs or trying to prevent STDs. And so it reinforces that idea that nobody I know has ever had one, so it can't happen to me either. So trying to get a conversation started with young people around STDs, condom use, responsible alcohol use, all of those things are really important in countering that misperception that it won't happen to me. So a lot of the work that we're doing from an educational perspective is trying to correct ideas about what's normal for young people. I think there's a misconception that college students are going out, they're getting drunk every night, and then having high-risk, unprotected sex. That's this popular conception of what young people are engaging in, and we see it in movies, we see it in TV all the time. But we know from the research that that's not true. That's not the norm for most young people. Most young people are really responsible with their alcohol use. Most young people are either not engaged in sexual activity or are taking steps to make sure that they're reducing their risk for STDs. On the flip side of that, I think there are a lot of misperceptions about who this does happen to, that it happens to people who have more sex than me or who have different types of sex than me. It happens to those people over there. And so challenging some of those myths and misconceptions that it really can happen to anybody, anybody who's sexually active can be at risk if they aren't taking precautions, if they aren't using condoms, etc.
Now, what can parents and educators do to better educate and prepare youth?
We can be having open and honest conversations with young people, which I know is really challenging for many educators, for many parents. It can feel uncomfortable, it can feel a little scary, but we really do need to have those open dialogues with young people. Young people, in my experience, are really hungry for people to talk to about these things, for safe spaces where they can have conversations, and we aren't giving those to young people in systematic ways. So being an open person, being somebody that is an askable adult is so important to many young people. So I think that's the most important thing that we can do. And I think also, in addition to conversations around STDs, sexual activity, talking to our young people about responsible alcohol use and what that looks like. So much risk-taking, especially on a college campus, is fueled by alcohol use, irresponsible alcohol use. And if we can be having a dialogue about that at the same time, I think that'll really help us in multiple realms.
Very good. Now, what resources are available to university students?
Well, at UNL, we have the University Health Center. We have a fully staffed medical clinic with testing and treatment options available for students, all confidential. We also have a pharmacy on site, so students can get any medications that they might need. We also have our education department is located there, and we have a lot of resources for students in terms of prevention, safer sex supplies. We also have a counseling and psychological services office. A lot of students can be very upset when they find out that they have an STD. They aren't sure how to talk to their partner about it. So we have some good resources to help them through those situations as well. In addition, we have an HIV testing site that is that's out of the building in the Gone Multicultural Center. So we do free, anonymous, and confidential HIV testing there, along with peer counseling. So young people can talk to somebody their own age about ways that they can reduce their risk for HIV.
Great, very good. Well, thank you both for coming. This is really important information.
Thank you.
Thanks.
Thank you. Now, when we return, we'll discuss some other things that are serious issues for youth. Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.